Hello, my dear friends. Welcome to Aspire 32. And after many days, I was able to get one of my teacher on the Aspire 32. And this is really a special podcast for me because, I have done a podcast where people have come from, they have gone to US and they have come back and settled in India. But sometimes the journey is really special and, it is really inspiring. Thanks to Dr. Vinayak sir for accepting my invite to agree. He agreed that he's coming to come on Aspire 32 and speak on his amazing journey, which I'm really interested to listen. Welcome to Aspire 32, sir.
Thank you, Suresh. Thank you for the invite. I'm really happy.
Sir is currently working in Louisiana State University, and he finished his dentistry in Ohio State University. He finished his BDS, MDS in India, and then he went to US, and then he came back. He was here in India, and again he went to US. So this is a very interesting journey, and I wanted to take sir's experience so that this can be shared with the young budding dentist, which we can inspire, sir. Sir, my first question is, you were my teacher. You used to teach us so well, and then you have worked here for so many years, and then suddenly you decided that you want to go to US. What was the motivation, sir, and how did this thought come in your mind that you want to go to US?
Okay. Thank you, Suresh, for those nice words about my teaching, whatever I did. Thank you. I appreciate that. Um, yeah. I mean, let's talk about my journey. And like you said, it's an interesting journey. It's a kind of a little weird one as well, I would say, in terms and in how people perceive it. But yeah, it has been a really interesting and a very long journey. I mean, to reach here. But nonetheless, it's been good. I mean, there's no doubts about that in the end. To begin with, I mean, when I started right at KLE, I finished my MDS from Courts Davangere, and I was lucky enough. I had a very good teacher for myself as well, the one who motivated me. So when I got out, I wanted to do a lot of research as well. So I wanted to do practice. I enjoyed always. I have enjoyed working in clinic with my patients. And get that sense of fulfillment in the clinic. But I also wanted to, I had always that inquisitiveness for research and to learn more. So that was the thing. So I always felt that okay, there is so many things that I still need to teach myself. Because one thing is that when I finished my MDS, long time back, I should say, it was 2002 that I finished, right? So at that time, implant was only didactic. We didn't get to train clinically. So and things, stuff like that, and we used to read a lot of things in the journal of all the different techniques and whatnot, and we didn't have access to all those GTR membranes, be it Emdogain, which is like all those different things we didn't have access to. So I was like always curious. I want to try that. I want to learn that. I want to do that. So that was always there. So and I thought the best place for me to try and attempt to do my research and as well as train myself was the US. So that's when my quest began. I started, working while I was in KLE. I was also doing a small little research there, trying to get my research, set up there. But that was not possible. So then I started applying, and those are the times where online applications were not there. So it was more of a paper applications or whatnot. And then I had a telephonic interview. And then I got accepted here at Stony Brook. And then I came here at Stony Brook, New York, Long Island.
So this is after how many years of your post graduation you
So
shifting to US?
yeah, so I finished in 2002, and then by 2004 I had finished my TOEFL, my GRE, because that I was applying for a PhD come master's program, and that needed a GRE at that time. So in 2005 June, I was in New York. So it was pretty much taken me almost 3 years.
That's really nice, sir, because there are students who struggle for many years even to go to US. And I'm sure that because you finished your post graduation, you had your work experience, you already did some research, that definitely helped you.
A student does not really need an MDS or a master's or a job experience to be accepted here in a university here in US.
Okay.
A student right fresh out of dental school can apply and come here. And there are many instances when we can talk about it. I can give examples of
Yes,
that.
that is what I wanted to ask you next. That you said you have gone, you were looking for a program which was giving you research and masters,
Uh-huh.
research plus masters. Can you tell me something more about such programs, sir, which can be helpful to students?
Yeah. So initially, when I started out, I wanted to do a PhD here, right? I mean, that's the best way to get research done. But then one thing that is different is that when you apply for PhD in a dental school, the PhD is offered by the department or the department of the program, which is called as oral biology. Okay, and that PhD can be related to any kind of research. It can be the research related to an endo. It could be related to orthodontics, periodontics, prosthodontics, either of it. Eventually, it will be a PhD in oral biology. What research you do depends on the mentor who is and what kind of research they are doing and what kind of lab you are in. So that determines what kind of research you are doing. You won't actually get a PhD in peri, or you don't get a PhD in orthodontics or prosthodontics or any such kind. What you would get is a PhD in oral biology. So it's an oral biology program basically. So I wanted to do research, so I did apply for a PhD program, which eventually, because of certain circumstances, I ended up doing my master's. So I ended up with a master's in oral biology at Stony Brook. So I finished that by 2007, and then in 2 years time, and then I moved on to Ohio State University, where I joined as a postdoctoral researcher. Okay, and that is where my next journey began. Actually, is my mentor, Dr. Purnima Kumar. She had just taken up a faculty position. She was just starting a research lab, and she wanted someone to set up the lab and have it running. So I was there, fortunate enough to be there, and we started the lab, and we worked on quite a few projects. And yeah, and that's we'll talk about that next part of the journey.
Okay. So I'm sure, sir, because we keep on hearing that this visa issues and all are very high, and there has to be a specific profile or job, then you can get the visa. So this you said you were into research, and what type of visa do you, and how easy is to get the visa when you have such opportunities?
So absolutely. I mean, talking about visa, that's another whole big topic in itself. But yeah, so when you apply for a program and you get accepted, so you're going as a student, right? So that is absolutely not a problem. So you go on an F1 visa, which is a student visa, which is also a non-immigrant visa. So basically, you are stating that you are going there as a student and you are not going there for immigration, and you intend to come back as long as you are able to establish the fact that you have sufficient funds to support yourself, right? So that is the school fees and the lodging or whatever, and all your daily expenses. You're able to cover that whatever for the given period of time, that is 2 years, 3 years, whatever period of time you're planning to go. If you can establish that you have enough funds to cover that, and you plan to come back, there should not be a problem that you would get that F1 visa.
How would like let us assume, sir, there are of course finance. Anything in US is very expensive when we convert it in INR.
Yeah, yeah.
Does the programs like PhD, the research scholar, do you have any idea if someone can sustain the living with any stipend?
So the thing is, when you actually apply for a PhD program, okay, not a master's. So a lot of students, what they do is one easier way that they want to can get to come and get things started here in US is they apply for a master's program, usually masters in public health. It's an easier admission way. They get easily get accepted there, and they get the F1 visa and they come. But most of these masters program, they do not assist you. They do not fund you. They do not give you any kind of financial assistance. Okay. But a PhD program is totally kind of assisted, as in like you do get a good amount of assistance. So your fee is pretty much waived off. It's covered by your mentor, pretty much, or their funds or the school. They usually the program usually covers through their funding, through their grants or whatnot, and you do get a good amount of stipend there. Okay, then that will help you sustain through your PhD. And PhD again does not have a certain number of years, right? I mean, it could take anywhere from 4 years to 7 years or whatnot. So for all through that period, you will be kind of you'll be helped. You'll be receiving a stipend. So if you are doing a PhD program, so you should not, you won't be in much of a financial crisis. However, for the visa purpose, you do have to show that you have funds.
Okay.
The stipend that you get is once you get here and get your program started and you are accepted here and you start the program. That's when and then you are in a lab, and then but there is a certain amount of money probably you'll have to do as an initial expenditure. You'll have to pay it first, but then that will get reimbursed because you get paid and the whatever. That's one thing. But eventually, when you go for the visa, you do have to show that you have enough funds to cover the fees. They do not state there that okay, you are getting paid and it's all getting covered. No, that's not anywhere stated as such.
Okay.
Okay. Yeah.
But as you said, sir, in the beginning, that you can be just a BDA student and you can get into admission. But it is very difficult, sir, because I have seen that everybody does, as you said, MPH, and they go. If it is that easier, then why not the students are applying? What can be few important things for undergraduate student if they want to think of getting into such programs just after BDS?
Yeah. So yeah, the tricky part here, Suresh, is that applying to program is not a big deal. Okay. And the reason why people come here to do MPH or any other program as such to begin with is an opportunity to be here so that they can get the national boards done. To complete the national boards, one has to be in US. He has to come here and he has to complete his exam here, the national boards part 1 and part 2. So so for some people who have an access, who have enough funds to just visit US to finish those exams, I have seen students who do that as well. They do couple visits and they finish the part 1, part 2, and they get it done, and then they apply. And for those who probably have limited or whatnot funds, they or some choose that they would want to come here, stay for 1 or 2 years to do their MPH. In that time period, they will finish the national boards and they will go in for an application. So this whole application process is a pretty lengthy one. So if I have to talk about it, and do you want me to go elaborate on that one?
Yeah, maybe a little bit more, sir.
Yeah. So it is that you finish your national boards part 1, part 2, then you put in your applications. So if you are planning for dental to be in the dental school in 2026, you put your application you start planning in 2024. Finish your national boards and all, and start 2025 is when you put in your application and go in for the interview and get accepted, right? And then 2026 is when you go to school. So it has to the process has to begin pretty early on.
That is PhD, sir. You said somebody can get into PhD also. By any student without any experience, work experience. How easy that?
You don't need work experience. Yeah. You don't need work experience. So of course, one can always get into any university website and check on their oral biology program, see if they're accepting students in that coming year or what so, and reach out to that program and try to show their interest to be there. along with that, I would really encourage a good CV in terms of having done some kind of research as a dental student, like a poster presentation somewhere, some kind of a small little research, something to show that they're interested in that field, that they are committed, to research, and they genuinely have that interest. So as long as they're able to establish that, and they put up a good, a CV, good statement of purpose, all of that, there may be an interview process as well. Of course, the screening process will be pretty, competitive. Maybe a lot of people applying too. As long as you're able to clear that, one should not be able to. And it's not a problem to get in the PhD program. And there have been instances who have done that. I mean, a lot of students do that.
How good is this option, sir? Doing PhD. There are many times many people have told me that if people do DDS and get into this clinical practice, they end up with a good financial status. But
Yes,
if you are a faculty, then this is what people tell. So there is hardly
absolutely.
any information, and that is why
Understand.
this podcast is so important, and you are so important to guide the students.
Oh, yeah,
Will
yeah,
that be a good option?
yeah, yeah, yeah. Okay. So yes, absolutely. Getting into clinical practice, or setting up your own dental office is always a very, very good option, considering the finances. Okay. Now again, it depends on the student what they are looking for. Is it finances, or is it a satisfaction as a career, as if as a researcher, as an academician, or if what do they end up wanting to do? Okay, right. So yes, I mean, at the end of the day, finances is important, and nothing can match what one can make out of a clinical practice. But then it also takes that kind of funding to begin with, right?
Yeah,
So getting into DDS, of course, again, that's another different ball game. It's more competitive, or equally competitive as getting into a PhD program, I would say. There are a lot of students, not just from India, but from all around the world, dentists from all around the world, who are
yeah,
applying to these what is called as the advanced dental education program, right? Wherein if you have finished a dental program anywhere outside US, you can join into an international dental program, where you can do a 2 years of DDS, and then be licensed to practice. But getting into it, that is as and more difficult. You need to probably do not just national boards. I've even heard people have to do
yeah,
ADAT exams too, and then apply. Okay, and again here, the fees, or the that you have to pay every year, is pretty high.
yeah.
So if one can fund himself so much and sustain for those 2-3 years, and then yeah, I mean, that's a very good option, of course. A lot of them also directly get into MS program, like they want to do an MS perio, MS endo, MS ortho, or whatnot. They can directly apply, and they can do that as well. That's a 3-year program, right?
Yeah,
In
but that is
those
also
fields.
quite expensive, sir. When I cleared my NBDE and even ADAT,
Mhm.
I used to prepare in India. I just went there for one
Right,
month and I gave the exam.
right, 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 right. Even
And
in that.
ADAT was the first month. I went to give the ADAT. During the first month, it was announced. It was very, very new. They asked a lot of implant questions, which was very challenging. As you said,
Mhm.
it was more of a, even for me, it is theoretical even today. Uh,
Yeah, yeah.
so it is definitely, it's a big challenge. But as you are saying that of course the fees is so much in if you want to do advanced studying program where the PhD is funded. But if you let us assume a students get into this PhD program, what does the future hold? Like what all he can do, sir? I have heard that some schools give PhD plus DDS. You can get into such program.
Yes,
You
yes,
can
yes.
become a faculty after your PhD. So can you give some ideas or what exactly people can
Yeah,
do
yeah.
after PhD in US?
Yeah, let me set something straight here. I am not advocating PhD. I am not saying that it's the easiest path. It is the path that I chose because I was
Yes.
interested in research. Okay. For someone who's trying to get into PhD, and then that if that is the way they're looking into, and then eventually their aim is to get into clinical practice, this is a very, very long road. Please don't take it. Don't try to think about, oh, I'll finish my PhD and then I'll finish my DDS and then I can do clinical practice, because you never know how long you're going to end up doing PhD. And then once you're into clinical practice, all that PhD is not going to be of any help to you of much. There are programs that offer PhD DDS, like you said, or PhD MS program. Okay, one of my colleagues, again from India, he did his PhD. He got into PhD, and eventually, like in third year and second year of so, he thought that, oh, I should do my MS as well. He talked to the program, and they were ready to accept. Though that program did offer this option long time back, but they had stopped it, and then they renewed it for this person. Okay, so he got into, but he finished his PhD, I should say, in about 6 or 7 years time, because then that gets added. So if you're doing a DDS PhD or PhD MS, you do 3 years of your PhD, and then you do 2 years of your DDS, and then you do 1 year of your PhD again, and finish up with and graduate with both. Or you do 3 years of your PhD and 3 years of your MS, and then the last year of your MS, you graduate with MS. As in, when I say MS, I mean residency program. Okay. Yeah. Again, in residency program, when I say that, means it is as good as MDS in India. It's called as residency. It is offered as a certificate, or it is offered as a master's program. So when someone is trying to do combination of a PhD with this residency, they do 3 years of PhD, they do 3 years of their residency, and graduate with both the residency certificate and PhD at the end of 6 or 7 years.
After doing so many things, you came back to India again, and I wanted to know that why did you decide to come back? It may be like in a small explanation. Like, was it because of any visa issue, or you thought that you would like to move to US for some other reason?
Yeah, no. So what happened was, like I said, I finished my master's in oral biology from Stony Brook, joined Dr. Kumar's lab. We were working, and I was, about to apply for my to do my perio. So I realized that, okay, this PhD or this master's is not going to really help me get a position as a periodontist. I was already a periodontist in India, right? So I had to do my MS perio again here. So I was applying to apply for that. There was certain family issues that came up at that time.
Okay.
So because of which I had to come back.
So then you came to India, and you were here for how many years, sir? You were here for 4-5 years?
No, almost 9 years.
You were here in India for 9 years. I remember.
Yeah.
The day when I think we were in an institute where we were giving. I was giving a lecture on MDS entrance exam, and you were giving a lecture on the abroad options to the students. I think maybe after that 1 or 2 years, you again moved to US.
Yes. So I moved back, and then I came to India. So with an intention that, okay, I really didn't want to go back, right? I mean, I was trying to go to the next level of doing my MS Perio here. I had to come back. Then always had a plan that, okay, somehow I need to work towards trying, and hopefully if I can get back and complete what I really dreamed of and really planned of, right? So, but I started working. So the intent was to keep up my research. So I joined an institution where there was some research going on. I was able to do that. Then I enrolled myself for PhD. So that at least, while I'm waiting for things to pan out and things to happen or whatnot, let me finish this PhD. So I ended up doing my PhD back in India. So after I finished my PhD, there was an opportunity that I got back again. And again, thanks to my mentor, she offered me a postdoc position again here in US. Yeah, it was a difficult decision, after 9 years, closing up your clinic that you had, and everything, and whatever was going on at that time. But I did, like I said, I always had that in the corner of my heart. There was that hope, and there was that wish to complete my dream, right? So when I got this opportunity, I just took it up. It was
Yeah, and that is what is really inspiring, and that is why I wanted to do this podcast with you, to understand certain aspects. Like, I'm sure you had, your family, your kids.
Yes,
Then you
yes,
decided this time
yes,
again to go to US.
yeah,
Was it is it easier? If suppose let us assume that there is some person who decides this.
yes.
How easy is it? Like, do you advise them something like they can think ahead before doing that decision so that this
Yes, absolutely,
transition can be
absolutely.
easier?
Yeah, I would say that it's as easy as climbing Mount Everest.
Yeah. Okay, that's quite
So,
challenging.
so yeah, I mean, one needs to prepare for it. I mean, and it does need, especially if you're a person who has a family and kids, it needs team effort. You need the understanding, the help, and the cooperation from your wife and your kids to make it happen, because it is certainly not an easy job with kids, with family, trying to get out of your job, be a student for whatever 3 or 4 years, or because like I said, it's a whole process, right? And the program may be 3 years, but then you have to start earlier on. So it's a task. So think about a person who is having earning whatever a take home money every month, and then you suddenly that is put to stop, and then you are in a total different zone, and then being on the other side of the table, you are sitting as a faculty at one day, and the next day you are standing the other on the other side as a student, and going through the whole process of that being a student can be tough, considering the the time gap that was there as yeah, but it is achievable. I mean, I did it. I'm sure more people can do it as well, but does need a lot of hard thinking. Yes,
Very true, sir. I'm really sure that it is not that easy. The application itself is so tiring, and I understand with family, everything. Suddenly, every all new decisions has to be taken. But I'm really inspired, and I'm sure the students will also appreciate
thank you, thank you,
whatever you are saying today. So
thank you.
you went back, and again you got into this master's program. You
Yes, yes, yes.
you went into master's program.
Mhm.
And if I can ask you, like, I'm sure that again, being a student, it must be interesting. It's a new phase, and
Yeah.
living as a student, because we all miss the student life. It must be interesting.
Yes, but it is not as carefree student life as we had before, right? I mean, for me it was a different thing because I had family. I had when you are in school, you are a student, then you come back, and then you are back again as a as a person of the family, having to handle issues there and whatnot. So it's not as such carefree life as it was before. So certainly, I do not see myself going back into what I was a couple of years back. No, I don't want to be there. But my earlier student life, yes, I do cherish it. But yes, it was interesting. So let me put one more thing, since students are going to be watching this, right? I mean, is that if someone is trying to apply for a program, right, be it any specialty, think of applying to multiple programs at a time, at least 10 programs at a time, because getting interviews itself is difficult. Getting interviews, and then clearing through the interview, and then getting accepted, right? And then now a lot of things have changed in the application process. It's something called as a match and pass program. That is a centralized process, right? So you need to get matched to a program. It's not that any program can accept anyone. It has to go through a channel called as match process. So it's a tough one. So that's the reason I would advise anyone applying to apply for as many schools as possible. It's expensive, but even the application process, but at least it gives you a fair good chance, right, of getting an interview, and then moving forward. Yes,
Sir, so you went back and again did your masters in Perio, isn't it, sir?
yes, yes, yes.
And how was the experience of doing masters in periodontics compared to the masters in periodontics in India? Was it way different, or do you think that it's quite similar?
Um, so, I mean, periodontics is periodontics no matter which part of the world you are in, right? I mean, you're treating the same kind of tissue. The whole concepts pretty much are same when it comes to that. But it was different in terms of the experience, okay? I mean, we pretty much read and did the same things, but I was able to do much more different techniques and use different materials. And that was a very good experience for me. No matter what kind of bone graft, what kind of membranes we could use, different techniques of doing the same procedure of be it guided tissue regeneration, guided bone regeneration, or be it covering recessions. There are different techniques that I was able to do it. I'm sure a lot of students get to do that in India too, but from what I had an experience of learning perio in India and teaching perio in India, there was not availability of a lot of different materials. Maybe it was a school that I was teaching and learning. Maybe there may be other better schools, but that was my perspective. That was my understanding, and so here I got to do learn a lot more.
So do you think that the teachers should be more open-minded, accept new things, try to bring change rather than accepting what is given by the curriculum? Do you think that is a change required here?
I mean, anywhere, right? Anywhere, it should be a good blend of what is existing and bringing in new things. So that I think is the fun part of teaching, right? I mean, when and you need to keep yourself updated of the new things and try to implement it and bring it to the awareness of your student, because they are stepping into tomorrow, right? They are going to be the next generation, so they need to be aware of what is existing and what is coming, and they should be ready to face that, because they should be able to apply it and or modulate what is existing to the next that is coming up. So you're sending the students to tomorrow, so you need to kind of get them prepared. So I would say 80% if you're doing the existing one, 20% put the new things into them, or give them the thought process of
Yeah.
applying.
Okay. So right now you are also a faculty, sir. You are working as a faculty.
Yeah, I'm a faculty. Yeah,
Okay,
I'm a
I just
faculty.
had one question here. I don't have a lot of questions. I'm sure you are quite busy, although this can keep on continuing. But
Sure.
since you have so much experience, it's such a big journey. I'm sure that I can get some more from this podcast. You have
Sure.
worked here in India, and you, like an organization or as a teacher, or
Uh-huh.
you have worked again in US. Uh,
Yes.
what are the what do you think are good things when in this aspect, like when it comes to work experience as a faculty? Do you
Mhm.
think that adds up because of that things are better in foreign countries? Do you think?
So yeah, so the difference I see is that as a faculty here, I'm more busier. Every
Okay.
moment of my time is accounted for. And I'm accountable for every moment, right? So a typical day of my work day is this way. Okay, it starts at 8:30, so and goes all the way to 4:30. So it's divided in two sessions. So 8:30, if I'm teaching, right, I usually teach in a pre-doc or a post-doc clinics. So it starts from 8:30 to anywhere between 11:30 to 12 o'clock, and at that moment we are so busy, so involved, right? I mean, it'll be only one faculty for if it's a pre-doc clinic. There are like 10 different chairs. So if 10 chairs are booked, so I have it's me and there are a couple of other faculty who's there. So we are totally engaged from 8:30 to 11:30. There's no time. You cannot move out of that clinic for even 5 minutes. And then afternoon again, if I'm teaching again from 1 to 4:30, so that's pretty much the whole day is gone. Then I do get one day in a week probably to do my office job. That is, I have to I direct a program, a couple of programs, so I have to look into that. The exams, running of the program, answering to different emails from the students or whatnot, approving their patients and all of that. So that's pretty much done. And then I do get one day of faculty practice that I do. So that's pretty much, so it's a pretty busy week. It goes on. I'm sure that's pretty much how it is, right, in India too.
Yeah, it's quite. If you want work, then definitely there's a lot of work to do here. I am also trying to do more of a microscopic work. The motivation, like we need guides, who can teach us new techniques, and then that is what gives motivation. As you said, we all have to learn uh, new things. I'm sure you this was your dream, and that is why you went to US.
Sure.
I have two
Mhm.
questions. One is, what are the things from India you miss, even though US was your dream? And second is,
Of course.
what is your few advices for students? Who anyone who thinks of moving to US, in maybe at any age.
So the one thing that I miss is, of course, friends and family, right?
Yeah,
Um, so spending time with my friends and family. And another thing I miss most is the food
food.
from India. From India, yeah. Of course, we do cook home, but Indian food here. So I miss that.
Okay.
So for anyone to any student planning to come to US, of course, plan it out early. You need time to to plan out where you want to apply and what all the whole process of application is. So every website, every school website or university website has all the details. If you don't get enough details, directly email to that program, whoever the contact person is. Try to talk to them and show the interest. Okay, that's first thing. So plan that out. As asking me is go on to period.org. Okay, and then there is, if you look at, there is US postdoctoral programs. So that enlists all the universities that offer the perio programs, but at least gives you a list of all the universities. You have it on your hand. Then you can look at whichever program you're interested, be it endo, prosto, ortho. But at least you get a list. So that's an easy way to get a list of all the US universities. So go take that list, use that, get into the program, find out about the fees or whatnot, plan out. Like I said, plan out at least 8 to 10 universities minimum application. It's expensive, but it at least gives you a shot at getting interviews from few universities. Do your TOEFL, of course. Do your national boards part 1, part 2. Even if the university says that it's not mandatory. Just it's so competitive. If you add that to your resume that you have finished these exams, it gives you a better chance again. So that is another thing. One more important thing that I would say is when if you visit US, plan to do an observership or an externship, at least a day or a week's time in that university where you plan to apply and get into. Because when you are there, you get to see, meet the faculty, meet the residents that are already doing the program, talk to them. It also generates and feeling for the school or the program that you are interested in their university. It shows that you're genuinely interested. That is very important, and that makes them give you an interview call. Okay, because like I said, there are like for any program that has like 3 to 4 openings, positions or seats, if I should put it that way, there are like hundreds of applications, out of which they probably, if there are 3 positions open, they probably call about 21 to 24 people, 3 to 4 times of no people, 7 times, yeah, over a period of interviews, right? 3 or 4 days of interviews. One person will have only one day, but that interview process is that way. 21 or 24 people, they choose only 3 people, right? So that's the kind of, and you are, if that is a person, that person is from, so that's the kind of competition you're looking into. That is the reason, you need to really show that you are interested. So try interacting with the faculty, try interacting with the students, try visit that program if possible. That increases your chances. So these are a few things I would say. Again, career options. What I will say is, of course, if you're an international candidate, trying to get your green card or whatnot, getting into faculty position is easier, gives you better chances at your green card. That's the reason why a lot of international students who finish their masters end up becoming a faculty. It's not by choice most often times. Okay, and after they get the green card, probably then they can get into clinical practice or set up their practice. So again, so doing a DDS and getting into practice may not be that simple. As long as you're not, if you're promised your green card, then you're fine. If not, then getting green card would be an issue, right? So that's a different topic. So you can become a full-time faculty. You can be into faculty where you're only into teaching, or you can be teaching and research. And most often that is how it goes. You can be in academics and practice. And most often times as a faculty, I get to do 1 day of faculty practice. So you can do that. Or you can be a part-time faculty, part-time clinical practice. But again, being you have to work out with your visa issues and all of that. So these are a couple of different options here, and then again full-time practice. So this is pretty much how it works in India too, right? These are multiple options you would have. So yeah, think about what you want to do. Think hard, talk to people, and then give it a good try. When you
Thank
try,
you so much, sir.
Sure.
This was wonderful, to talk to you after so many years. You gave me your time from a busy schedule. I'm
Yeah,
sure that this was a very inspiring podcast for anyone who thinks, age is a limitation.